Today is World Polio Day, and the World Health Organization believes it is closer than ever to eradicating polio, but says more still has to be done.
Joining us now is, we have all the way from Abuja, I believe, Dr. Tunji Funshaw, who's chairman, Nigeria National Polio Plus Committee of the Rotary International. Thank you, and thank you for joining us on the show this morning.
Thank you very much for having me.
At what point do we declare Nigeria polio-free? We celebrated 1 year, I think, in 2015 before 2 cases were discovered the next year. There are people who are saying that there hasn't been any report of polio in the past 25 months, but that there was evidence of polio virus in the environment. Help us understand this.
Well, I'm actually in Lagos currently. Thank you very much for having me once again. We saw our last case of polio in Nigeria, that is the wild polio virus, in the Northeast in August 2016. Currently, we have not seen any case of wild polio virus either in the child or in any of our environmental samples. What we've had in recent times are what we call vaccine-derived viruses. In other words, children, when they are vaccinated, will still pass some of those viruses in their stools. And sometimes because of, poor sanitation, they find themselves, the viruses find themselves into our sewage system, and they get contaminated, and usually malnourished children can get infected with a mutated, version of this vaccine. So we really have not seen any wild case of wild polio virus, either in the environment or in any child for the last 25 months.
Okay, so can we safely say it is uhuru for Nigeria as far as the issue of polio is concerned? Or what exactly do we need to do so that we don't, 1 minute celebrate that Nigeria is polio-free, only to find out that it's still very much with us?
Oh, no, it's not uhuru. It's not uhuru yet at all, by any stretch of the imagination. What we can see at this point is that we've been doing the right things to ensure that we keep the virus at bay. And if we continue doing these same things, which is essentially accessing every child wherever they may be. Number 2, ensuring that our surveillance system is robust enough so that we pick up any case of polio wherever it may be in this country. Then by this time next year, WHO will take us the list of polio endemic countries.
And the issue of availability of vaccines remains very, very serious. How does Nigeria, fare in that area?
Well, we do not have any problems of availability of vaccines.
Okay.
Vaccines are available in adequate, quantities. Our challenge usually has been getting these vaccines to children, either because of difficult terrains, and that occurs all around this country, particularly during the rainy season, when some areas that are normally motorable becomes unmotorable, or in areas that are security compromised. Those are the main challenges of getting the vaccine to the children, and not the issue of the availability of the vaccines themselves.
Dr. Funshaw, in 2012, 100 cases of polio were reported across the country, and it's interesting how we've achieved such a huge success. You mentioned that the last time polio virus was discovered here was in 2016. Are we improving on the factors responsible for these successes?
We keep improving all the time, and we're quite fortunate that we have commitment from all the tiers of government and all the partners involved. At the level of the federal government, the state governments, and local governments. They're not, as perfect as we want them to be, but continuously with, getting buy-in by our partners at the government level, federal, state, and local government, as I said. And also our leadership at the traditional level and also at the religious level have been major partners in ensuring that we get acceptability of the vaccines and also in helping us to reach children.
There has been a lot of myth and ignorance surrounding polio vaccines. As a matter of fact, some parents have actually asked, and questioned, why the federal government will make polio vaccination free, while in their words, instead of providing other vital social services. I wonder how this is playing out in contributing to this polio that just refuses to die out completely in Nigeria.
Well, that's a major factor in some of the areas where we meet refusals by communities, because they believe that polio is not the only disease that is ravaging their communities. Everybody is quite correct, but the important thing about this effort is that polio is about the only disease that has been ravaging our children for centuries. See, when we started this program 30 years ago, we're having approximately 1,000 cases of polio every day. We're talking about children belonging to families being paralyzed by polio. As of last year, we had just 22 cases. Those are still 22 cases, too many. But that has been the vast, improvement we've made, and it is the only disease now that we have the resources and the wherewithal to eradicate, and that is why we're so bent on doing so that all the resources we're expending on polio now can be moved onto other health areas and other, issues that affect communities, like, water and sanitation and rest.
So the Rotary Club has recently advocated clean as well as hygienic environment to end the transmission of polio. You told us earlier about the virus still being in the environment. I'm not sure that much has been done in that regard. Recall that when there was, what was this virus that one guy brought from Liberia? Ebola. Everybody started using, hand sanitizers
and all that.
Lagos, for instance, has become a bit more dirty than we've seen it in previous years. How important is this advocacy at such a time as this?
I think it's very, very important, that, sanitation, particularly the provision of safe drinking water. And Rotary is doing quite a lot in this regard. We're providing hundreds, literally, of deep bore wells all over the country. Some of them solar powered in those areas, that solar power, would be the best way of generating, and also to ensure that maintenance is, very low. We keep advocating. Rotarians all over the country as one of our areas of focus, water and sanitation. And so we preach, sanitation. We also have projects in, hand washing in schools. We build toilets, facilities in schools, and provide water to ensure that, children can learn hygienic habits so that they get protected from polio.
Yeah, Dr. Tunji, I'm sure many Nigerians actually believe they know what polio is, but for the benefit of those who really don't understand what polio is and what exactly to look out for, especially since it attacks children, well, how do you know that it is polio, is likely to be polio that's affecting your child or not?
Well, the good thing is that only 1 in 200 children who are infected by the virus end up with paralysis. And the symptoms are general, like any other feverish disease. The child, has a fever, may go off his food, may have a little bit of headache, sore throat, mild abdominal discomfort, and usually it passes away and nobody ever knows that this, was a case of polio. But in those children who suddenly are unable to use limbs that they were able to use before, a child who has been crawling before now cannot crawl, a child who could walk before cannot now walk, or a child who can hold on to something before, you wake up one morning or one evening, you discover that the child cannot lift an arm, then you know that this is a case of what we call acute flaccid paralysis. That is just paralysis. Okay. And then we have a surveillance system that will pick up this kind of child, collect a stool sample, and send it to our laboratories. It is the lab that will look for the virus in the stool. So there are many other illnesses that can cause paralysis in children.
It's all right.
All right, Dr. Tunji.
Give us information.
All right, Dr. Tunji Funshaw, thank you very much. Chairman, Nigeria National Polio Plus Committee, Rotary International, joining us via Skype right here in Lagos. Let's take it to Nike Abdulaziz, a pharmacist and Lagos State Polio representative, Rotary International. Good to have you on the show this morning. You've been, I've been looking at you with the side eye, and you've been agreeing with most of what Dr. Tunji Funsho has been saying there. But what is it about polio that really just targets the limbs of children?
Now, polio is a viral disease. And like he said, most of the time, a child could be infected and would not be paralyzed. But when the viruses, usually ingested by mouth, gets to the intestine and replicates, and then gets into the bloodstream, if the virus attacks the nerves, that's what happens. If it attacks the nerves affecting certain limbs, then those limbs become flaccid. In the same vein, if it actually attacks the nerves of your breathing pathway, we actually have death due to polio infection, but they are rare. That's it.
At what point then do you know that, hey, this is polio? What are the symptoms to look out for?
Most of the time, polio presents like a normal feverish condition. And oftentimes, many kids have polio that their parents don't even know they've been infected.
Wow.
But you see, most of the time, we only notice that it is polio when we begin to notice flaccidity of the limbs.
At that time, it's too late?
Most of the time.
Wow. So what do you recommend to parents, especially at the time where everyone has an idea of how to treat fever?
Most
self-medication.
Self-medication is actually one of the major problems for polio. If you take your child to the hospital and the child is examined and the doctor thinks there is a need to go further, yes, they will go further and take the child's stool to the lab. As a matter of fact, that's the only way to detect that a child has polio. Until you take a stool sample, you wouldn't know what is causing.
Okay.
the
Now,
fever.
let's look at the role ignorance, is playing to the, challenges in eradicating polio in this part, especially in the Northeast. There was a time when, you recall that issue about polio virus leading to some other diseases and all of that. How do you educate people, especially in that part of the country and everywhere, really?
Well, what Rotary has been trying to do is to involve the locals in our advocacy campaigns. You find out that especially in the northern part, they believe in their own people more. So if you go there, you're all well-dressed and all that, and you're speaking English, they will tell you, Baturinchi, I don't understand English. So you need someone like them, someone they can relate to, who can talk to them. And that's why we've been involving a lot of the locals in all our campaigns.
How successful has that been?
Oh, to a large extent, it's been successful. It's been very successful. Because they see people they know in every community. Let's take Lagos, for example. In Makoko community here, the son of the Bale is actually one of our advocates. So that's somebody who grew up in the slums with them. They know him, so they believe in him. And they're doing wonderfully well as advocates.
How relevant is the initial vaccination for newborn babies in this regard? And does that immunize a baby?
For life, or do you need to?
No, for a period of time.
We need to differentiate this. There are two types of polio vaccines. We've got the injectable form, and we've got the oral polio. Now, these two vaccines have different dosage. For the oral polio, which is the one we are using now, mainly because of the ease of administration.
That's right.
Most people don't want injections, but the oral one is easy for them to take. A single dose does not immunize you against polio. It's just the beginning of it. So we advise that at birth, before the child is a month or two, you give one. By 4 months, you give another one, and a total of at least 4 doses. The good thing about...
For children?
For children.
What
immunization is only usually for children between 0 to 5. 0 months to 59 months. Rarely do adults come down with polio. However, for children who have had polio before, there have been you could have some relapse when they become adolescents. But for new infections in adults, no.
So what could cause that kind of relapse much later? in life?
Residual virus in the system.
Okay, that's quite interesting.
Unfortunately, in this part of the world, we do not usually do medical checkups. You don't visit the hospital until you are already knocked out.
Even people who should know better.
How do we change? Because it's also a function of perhaps access to health care. There's also this myth about, we are very spiritual in this part of the world. We believe that prayer, answers everything. Yeah. But how do we begin to reshape that mentality to improve our healthcare system and, of course, the quality of health of our people?
There's something the Muslims say that I believe in. Trust in God, but tie your camel. You get it? So, we believe in God, but do your checkup. Then let God help you so that anything that is wrong with your system is quickly picked up.
Some will say, what you don't know cannot kill you. So
what you don't know can kill you. That's a very wrong adage. What you don't know can kill you. What kills most people is what they don't know. A friend of a friend recently died of breast cancer because she was living in denial. She has actually gone to do her mammogram. The mammogram detected it and said, you're at this stage, blah, blah, blah. She went for spiritual counseling.
Help. Okay. Well, let's look at the role of health workers and volunteers. The WHO has been, beaming a lot of such light on how those people actually are helping. What is the situation with Nigeria, especially when it comes to volunteerism in the fight against polio?
Polio.
Yes.
Well, we're lucky in Nigeria because we've got Rotary here working actively. Almost every Rotarian, almost every one of us is a volunteer when it comes to eradication of polio. We've also been getting very good cooperations from the traditional rulers, religious leaders, and that's how we've been able to come this close to ending polio in Nigeria. I would actually say that with the strength of health workers we have, we couldn't have gone this far if not for the additional volunteers that have come on board. So would
you say that total eradication is quite ambitious? Or is one case, let's say Nigeria only has one case of polio, is it something to still worry about?
I think you need to differentiate between wild polio and vaccine-derived polio. It is when you have a case of wild polio, that is when there is a problem. Like Dr. Tunji Funsho explained, if you have a case of vaccine-derived polio, that is not the problem. Usually that occurs in areas with unsanitary conditions, So if you improve the conditions of the environment and your immunization schedule goes as it should, you would have no fear.
You mentioned earlier about involving stakeholders like traditional rulers and all of that. I'm looking at the evolution of traditional medicine and even the proliferation of it. There are when you listen to radio, especially the local ones, they make you feel like, there are herbs that can treat everything. Is there a collaboration ongoing? Because you cannot, literally just say,
jettison
this is not relevant.
Yeah.
We have tried our herbs over the years and they have worked. But as a pharmacist, I do believe that there has to be some level of standardization in everything you do. If you boil your concoction with a small pot, same quantity of leaves, and I boil mine with a bigger pot, more water, we're going to get different concentrations of the actives, isn't it? And so if you drink a big cup and I drink a small cup of mine, I might be getting a quarter of the dose you're getting. We need to move to the stage where we stand. A lot of research is actually ongoing.
Are we working on that as a country?
Ongoing. Okay. Yes. A lot of research is ongoing. We need to standardize. We have another problem there. A lot of people have formulations, information gotten from their grandparents that they are not ready to volunteer. They think this knowledge belongs to my family. I don't know if you would understand. It's people who think herbal medicine is something they must only pass. It's generational. They must only pass it to their own offsprings. So we need to break that barrier. But to do that, we must be ready to give good remuneration for people who come forward with formulas that are
it has to come with a lot of
fantastic. It has to come with incentives.
Okay.
That's the only way.
All right,
to do
we'll
it.
have to leave it there.
Abdulaziz is pharmacist, Lagos State polio representative of Rotary International. Thank you very much for sharing more light on this.
Thank you. Very enlightening
nice
session
to be here.
there.